Perfect. You're ready to take notes. Great.
Yeah.
And this will record it. Okay.
Yeah, it's YouTube Live, and that's how I stream it to people. I didn't tell people I'm streaming it, but it always records the video after.
Perfect.
So it should be okay. What time will we decide? Well, you can give me a date and time, then I'll 100%. Okay, call you at 1 o'clock. Calendar. Well, let me call you at 1 o'clock tomorrow. Yeah, correct. If you have Microsoft, yes, but it depends whether you got it too. Yeah, that's why I'll see how old you are. But when I open the specs of the computer, it'll tell me if you have it or not. I'll take care of it, so I'll call you tomorrow at 1 o'clock. I got you. Thank you. You're welcome. Thank you.
So I
I got a pretty wide angle.
Hello. For those of you who don't remember me or don't know me, I'm Nancy Flynn, and I've been working with the Health and Wellness Committee for 4 years, been a resident of Harbor's Edge for 5 years, and I've had the pleasure, and it is a great pleasure, to be affiliated with FAU and the Medical School of FAU and the Nursing School of FAU. And today you're going to have a terrific opportunity to meet the new Dean of the Medical School, and she's going to speak to you about pain management. But most importantly, we've been working with Dr. Joe for a number of years, looking at different opportunities to expand on the health and wellness side of what LifeSpace should mean to all residents. And with that, we're developing new programs that will stretch the definition of Harbor's Edge as an independent living community. Because within independent living, we are somewhat limited or bound by the legal definitions of how residents can participate in different types of medicines or treatments within the definition of independent living. And pain management certainly is one area that I see across our residents. Either they've got a pain today, or they've had a pain, or they're looking forward to their next pain. And she's going to speak to that today, but know that we're doing a lot of new exciting work with FAU that I believe will be a benefit to residents in the next few years, on campus as well as off. So I'd like to turn this over to David Green. David is always my partner in crime. He's in charge of development, and he hasn't put his hand in my pocket often enough to support the efforts of FAU. And David will introduce the Dean.
Thank you, Nancy. And Nancy's just been an incredible partner, and it's great to see many of you I've seen in the restaurant and here. It's great to see everybody again. It's a great honor to introduce Julie Plitzis, Dean and Vice President of Medical Affairs. And she's not only our Dean, but she's actually a practicing neurosurgeon. She joined us this past February, comes to us from Albany Medical College, where she served as Division Chief of Functional Neurosurgery and Chair and Professor of the Basic Neuroscience Department. So she's an amazing surgeon and researcher, which is everything you want in a Dean. She's been funded by NIH since 2009, has been a principal investigator on multiple grants exceeding $7 million. She's a frequent speaker, and I love this, at meetings and grand rounds across the country. She's actually had a TED Talk. It's called So You Want to Be a Neurosurgeon. I've got to watch it. Has more than 250,000 views and counting. Here for only 4 months, Dean Plitzis has redefined the term hit the ground running, or should I say galloping, because she has been. In this time, she has created a vision for the FAU Health Network to bring academic health resources to 3.2 million people, the largest urban center in South Florida, incorporating Palm Beach, Broward, and Martin counties. We're right in the middle of it here. She announced the largest scholarship donation in FAU history, $28 million gift to medical school to jumpstart a plan for debt-free tuition for medical students. And she has redefined what it means to be of the community for the community by expanding the integration of education, research, and patient care, improved health and wellness for all. I could go on, but you're not here to listen to me. You're now in for a huge treat. Please welcome Julie Plitzis.
Thanks so much, and thank you all so much for coming. It's just a great honor to be here, and my family and I couldn't be more excited to have relocated to South Florida. I was telling Nancy and David, we made the very smart decision of moving from Albany in December. And so, with teenage kids, that's a tough, moving is tough, but the fact that I gave them sunshine and getting out of the snow has made me a better mom. So, and now following us down here, you know, my in-laws are on their way down to join us here. And it's just been such a pleasure getting to know the community. So thank you all so much for coming out. And, you know, today I want to talk a little bit about what I do on a daily basis. So, you know, David gave that wonderful introduction, which was so kind. So I'm a neurosurgeon, and when I was going through my neurosurgery training, you know, when being a neurosurgeon is one of those careers where it's kind of a conversation stopper. Like if you're like, oh, you know, I'm a plastic surgeon, everybody wants to talk to you. If you're a neurosurgeon, they say, oh, I hope I never need you. And so, you know, I think for me, I really wanted to do things that could really dramatically help people. And so that led me into the field of functional neurosurgery, which is neurosurgery to improve quality of life. And through that, I treat a number of patients with Parkinson's and movement disorders. And I also treat a number of people with chronic pain. And so today I thought we could talk about that and some of the options available, and figure out where everybody is in terms of this. And I mean for this to be a bit interactive if you are willing participants. So this slide, I like it for a variety of reasons, but you know, this looks at pain in America, and chronic pain is the hot pink area, and those are all the people in America that suffer with chronic pain. So 116 million people. That's more than cancer, diabetes, or heart disease all combined. So let's test this out. Who in the audience has chronic pain or any pain? Okay. Who has had cancer? Who has had heart disease? And how about diabetes? So the biggest, you know, I think that actually this demographic works when you saw how, you know, how everybody raised their hand. Say
I
again?
have a question.
Yeah.
On your sketch there, the pink.
Yeah.
The way it's showing there, you only show it in the better
It's not
eastern part of the
geographic.
states.
Yeah, and it doesn't, you know, it's just meant to be a cartoon. And so, you know, that just is trying to give you an idea of how many people, of what portion of the US would be affected by chronic pain. People all over the US and all over the world have chronic pain. This was just to get a picture going of it. Say again?
You'd be better off with bars.
Yeah.
This is too fluid.
Yes. And, you know, so I think that, you know, excuse the cartoon, just trying to give you an idea a bit about how many people this affects. So I'm not sure if we can read that from where it is, but when you think about pain, you know, why does pain exist? So pain has a purpose, right? So think about touching a hot stove. It's meant to hurt when you touch a hot stove, because then you're trying to protect yourself by pulling your hand back. And so it's a protective mechanism. And so pain is a natural thing that, you know, there's many reasons why we have pain. But what happens in chronic pain is that you start getting an abnormal response. So, you know, if you touch a hot stove, you're going to get burnt, you're going to have pain. But imagine the person with chronic pain feels like they can get burned by that stove no matter what they do. You know, you could be sitting, you guys know this, right? Who have pain. You could be sitting there and you could get pain. You could stand up from this chair and have excruciating pain. You could do a little too much, you know, pickleball, and you could have pain. And what happens is an abnormal firing. So I almost give the analogy, and again, pardon the analogy, of like the stove following you around the house and giving you pain no matter what you're doing. So what does that mean to you? If it's not, you know, we can all live with, okay, if I do this, this will happen. What about when you can't predict it? makes it hard to go out, makes it hard to plan, makes you not want to do things. So pain goes from being, when you have chronic pain, it goes from just being that sensation of pain to a whole set of things. So if you're not going out or not doing things, what happens?
You have more chronic pain.
You have more chronic pain,
And depression.
depression. Say again?
You get fat.
Yep, you can gain weight and then you can get more pain and more other problems. Then you got two problems. You get tired,
Anxiety.
anxiety.
The relationships change with loved ones.
Exactly. So, I think we talked about some of those emotional things that can happen and some of those physical things, but there's those social interactions that change where, I can tell you when I see patients in the office that have been suffering with chronic pain for 10, 15 years, I can almost predict what the relationship with the person next to them is going to be. Everybody is, it's such an interesting interaction that often that person is, that's with them is disengaged, often on their phone. And it changes how you interact. You can't do the things you want to do, so if you got grandkids or great grandkids you want to see, you might not be able to pick up the toddler that's going to be, squirming around. Anything else?
You get cranky.
Yeah,
You're in pain.
yeah,
Period.
yeah. You're miserable. And you can get cranky. And, what it does is it puts your whole system in stress. And living in that stress is really not good for anybody. So, what kind of pain do you have? You might go to the doctor and we might ask you for some words that describe your pain. What are some words?
How deep is it? How long should it last?
Yeah. So the doctor asks you, how deep is it? How long does it last? 0 to 10. What do you guys think about that 0 to 10 score? The secret, we think it's ridiculous too. And, actually there's a lot of reasons why that score doesn't work. And who do you think who reports higher numbers? You all or people in their 20s? People in their 20s do. And, so I guarantee you all have more reasons to have pain. There's certain circumstances where people in their 20s have reasons, but you all have reasons. But because, for a variety of reasons, people as they get older tend to reduce what they report as that pain number. So then what happens if you're reporting lower numbers than the 20-year-old that the doctor just saw? You get less treatment, right? And why else might you get less treatment when you're in your 70s, 80s, 90s?
You don't want it.
Yeah, you don't want it. People ignore pain and say sometimes, oh, it's in your head, right? What else?
Expect you to live with it.
Expect you to live with it. Well, you're getting older and, this is just what happens when you get old, right? Who's heard that too?
It's certain things you can't do.
Right.
Example one, you say, do the exercises. You can't do jumping jacks if you can't raise your shoulders.
Right. And, so that if everybody heard that, you can't do jumping jacks if you can't raise your shoulders. And, so some of the things that we as doctors tell you to do, you can't do. So what words, for those of you that have pain, what word would you use to describe it?
It hurts.
It hurts,
It aches.
it aches, it gives you stitches, terrible, miserable, constant, intermittent,
Limited mobility?
limited mobility. Anybody have burning pain? Burning, stabbing. And why do we care?
You can't do things.
Yeah. And why do you know why your doctor asked why your pain is like that? So there's different kinds of pain. And so some of the pains, and you know this, right? Some of the pains you have those arthritis aches and pains, right? So your bones hurt, and sometimes you're going to feel that often in the morning time. Then there's that burning pain, and sometimes that can be because you have a nerve tract. Who's had sciatica before? Yeah. And so you can get that sharp shooting pain down your leg. There's nothing you can do. And so the reason why we ask those questions and want to kind of figure out exactly where it is, and sometimes patients get really frustrated with me because they'll tell me, I'll say, where does it hurt? And they'll say the whole leg hurts, right? And I'll say, you got to point with one finger as to where that leg hurts. And why do I do that? Well, I want to know if I can offer you any surgery that might help or anything. And then I also want to know what kind of pain might you have? Because depending on what kind of pain you have, I'm going to treat that very differently. I pulled these off the internet, and I thought, I went to Google and I looked at, what statues depicted pain. And I thought that these two were kind of, what we were talking about before in terms of the sensory and then the emotional component of it. I think on the left is, when you feel exhausted, you just can't go on. And pain can do that. And then, when you're in the throes of it and what this can be like. So what can we do to treat this? Who's tried anti-inflammatories? Okay, a couple of people. Motrin, Aleve, any of the, is it Celebrex, Vioxx, Meloxicam, Tylenol?
Tylenol, extra strength for arthritis.
Okay, so Tylenol for,
Extra strength for arthritis.
okay, extra strength for arthritis.
And it used to last 6 hours.
I
Now
know.
I'm lucky if it lasts 2.
Yeah. And then we had somebody on Tramadol. So, that's another med that's commonly used. And
What do you think is the best?
gabapentin. Depends what kind of pain you have, and it depends on you.
You mentioned sciatica.
Yeah.
What's the best med for that?
So, I think if pain was easy, everyone would do it, right? As a doctor, it's really tricky to treat. So let's talk about sciatica. If somebody comes to me and is having an acute sciatic incident, I want to hit them with a lot of things. Because I know how bad that hurts. So often what I'll do is, if you can tolerate it, this doesn't work always in people with diabetes or osteoporosis, but I'll give it a little bit of a steroid because that can calm down the inflammation of the nerve. I'll often start on Motrin, and that'll be a pretty high dose. Sometimes I'll give you an opiate temporarily to take the edge off. And then there's things like gabapentin that were mentioned. Those are nerve agents, and those can be good and bad. There's a lot of meds that have a lot of side effects, and you get scared to death when you see those things on the TV with all the possible side effects that go through, but some have more than others. And so gabapentin's a great drug if you don't get the side effects, but it takes about 4 weeks to work. And you can't take it like you take Motrin or Tylenol. You can't just take it when you have pain. You have to take it all the time around the clock because it has to get into your body in a steady state. So a lot of people have problems tolerating gabapentin or Lyrica, which is pregabalin, the one after that. So I've started using other things that have been used for other things like depression or epilepsy that may not be particularly good at treating those, but they're pretty good at treating chronic pain, and you can get good relief from those in a couple of days. So those are some options there. Neuropathic medications are, one of my favorite. And so that's those antidepressants, anti-seizure medications. And those are things that can be really helpful if you have any of that burning, sharp shooting pain. A lot of doctors don't know about them and don't feel comfortable prescribing them. And so make sure that you talk with your doctor about some of these different options. Then there's things that are more invasive. Who's had an epidural steroid injection?
Might have an appointment for one.
An epidural steroid injection if you had back pain.
I have everybody.
They cortisone shot.
Yep, cortisone shot. And so, yep, so, and sometimes they work, sometimes they don't work. Who's had one that worked?
They work temporarily,
They work for childbirth.
and then after a while, they can't give you any longer.
Right. So a couple of important points there. So for epidurals, the general rule is that you can do them 3 times a year. And you have to be careful, again, if you have diabetes, to watch for sugar that can go up. Epidurals can be wonderful for some people. So I have plenty of patients that, even though it can be short term, they can, the drug, it really shouldn't last this long, but what it does is it kind of breaks the pain cycle. It breaks that excruciating pain you're in. And so people can go from 3 months, 6 months to a year without one. Sometimes they don't last that long, and it kind of depends on what you're feeling. Who's had any, go ahead.
Is it that it wasn't given to me in the right spot?
So most often it is given in the right spot.
Repeat the question, please.
So the question is it given, and did it not work because it wasn't given in the right spot? I would say most of the time it is given in the right spot. What I tell people is there's 2 different ways to do it. So, just in doctor speak, I can go one angle or a different angle. And so sometimes because of the arthritis around the nerves, it may not work as well one way. And we don't have any way of knowing until you do it. So if it doesn't work the first time, I would try again. I wouldn't get crazy about it continuing to do it. If it doesn't work, you can bang your head into the wall twice, but don't keep doing it because they're not fun.
Well, they won't do it. Well, the doctor's not gonna keep doing it.
I think just use common sense because sometimes, I think doctors want you to get so much better, but you tell them what's working for you and what's not. Who's had any kind of ablations? Anybody had any of those?
I have an appointment for one
Oh.
because this injection stopped working after a period of, they can only give them up to a certain period of time.
Yep.
And then the pain is so excruciating, it's recommended.
Yeah. So ablations are often ablations tend to work for back pain or knee pain after you've tried some injections. And so if the injections are doing just what she said, where they work for a short period of time and then it wears off, and so you want something longer lasting, what they actually do is, give some energy to a nerve to burn it so that you don't feel pain there. There actually can be done very safely. Most of the time people won't advise that. And it's not a first line thing. It's after the injections stop working. Go ahead.
Did you say that they do that for knee pain?
They can do it for knee pain too.
Even like if it's bone on bone?
I think they do a variety of different things. So everybody's a little bit different. But if have you had injections in your knee?
No, I'm
Yeah.
just wondering about someone else.
Yeah, no. So if you've had injections in your knee and those work, and you go, okay, that's great, but you can't have any more injections, then you can do those ablations. Go ahead.
The neuroablation,
Yeah.
how long does that work? I heard it's not a permanent thing either.
It varies from person to person, and none of this stuff, when you're treating chronic pain is one of the most challenging things doctors do, and it's one of the most challenging things you all live through. So it's very unlikely that any of these things by themselves is going to work. And that's why I'm talking about all of them, because oftentimes it's finding that perfect cocktail for you all in order to work.
Generally, the neuroablation.
Yeah.
How long does that last?
So,
2 months, 3 months, 6 months, 5 years?
Yeah.
What is the general end?
I would say 3 months to a year.
Can it be done again?
It can.
How many times can that be done?
I don't know. I have not seen anybody do it more than it's something that's done once a year, probably at most. Sometimes what they'll do is a different joint. So if you're in the back and you're at that one level, everybody, usually if you're going to have problems, you have it at the L4, L5, or the L5S1, 90% of people, that's where you have problems. Interestingly, you can either have, that's the most common place in the back. Oftentimes you'll have neck pain that goes along with back pain. And sometimes you can just have arthritis everywhere. But a lot of times when I treat people that have both, I ask where the pain is worse and I treat that area. And then, think about it, when you're walking funny because your back hurts, everything is off with your biomechanics. And if we can treat one of those things, the other gets better. People often ask questions about pain, at the bra area or similarly. That's very rare to have a herniated disc. You might have some arthritis, but it's like 1 in 10,000 times as common as having pain in the back or pain in the neck.
When you break something, you get that immediate pain relief, either the thing that you press every once in a while, every 10 minutes.
Yep.
And if that works so well, why not continue it?
Yeah. So the question is, she's talking about that PCA, the patient controlled anesthesia. Anybody had that when they had everything? I've had that too. And, I think one of the things that's really nice about and this is after you've had a big surgery or whatever, they give this into your IV and you can press the button that rather than pressing the button and waiting for the nurse to come and waiting for the meds, we get into this cycle where your pain is just getting out of control, where you can't get the meds. And this gives you control over it. And so they work really well, I think, in large part because you're taking control. And those are some of the things I want to talk about here. It's something that you get in the hospital after a big surgery. You can, one of the things that we do sometimes for people that have chronic pain is pain pumps. And so that is effectively doing that.
I think it was morphine.
Yeah. And there's a number of drugs that can go through there. One of the things I do is neuromodulation. This is different types of surgery. Most of the stuff we're talking about here is about, could respond to spinal cord stimulation. And so what is this? It is basically a way to trick the nervous system. So think about, I bump my elbow. What's the first thing I do? I take my hand and I rub it. And what am I doing? I'm tricking my brain to not feel that pain and to feel that rubbing sensation. So this is a device that can do that in your painful areas. And it's something, again, if you've had injections and, you don't have any primary surgery that might help and you need something more than what you're doing, this is an option down the road. Go ahead.
Yeah, I think that's why when I had massage therapy, they would, when you say, where is it? You can't just say it's your leg.
Yep.
She'll go along and see it until you get the right muscle. And when she presses that, it relieves it. What makes it worse?
Yep.
So you can find exactly the spot that's your problem.
And who else has had massage therapy for their pain?
Yeah, massages, but it's not for pain.
Okay. Well, I think one of the things I try to do as a physician is when I treat people, I try to treat people like I would treat my family members. And so, my husband, he'll have to talk to Dr. Joe back there, but had to give up his golf game because of problems with his neck. And so, he was in excruciating pain with pain radiating into the arm. And so what did I recommend for him? Well, I didn't send him for anything invasive off the bat, or, even as a surgeon, I wasn't recommending surgeon. So we started with massage. I think there's a lot of really great things about that because what you're doing there is, causing all the muscles to relax. And what else are you doing? You're taking away gravity. You're disconnecting from your environment. And so a lot of things that can make you feel better. What are other things besides massage that might be helpful?
How do you feel about chiropractic?
So, chiropractors and surgeons are like arch enemies, right? And, but having said that, my mom went to a chiropractor all her life. I think for lower back, I totally think chiropractor is great. I think for neck, just be careful and, use common sense. And if it's something that doesn't feel good, where you go, this isn't a good idea, direct them elsewhere. But I think so many people rely on chiropractor for life. How about acupuncture? Anybody tried that? No. Yeah. Anybody have success with acupuncture? Okay.
Hyperbaric chambers.
Hyperbaric chambers. Okay, so first acupuncture, and then we'll go to hyperbaric chambers. So acupuncture, I'm generally of the thought that things that have been around for 3,000 years are worth exploring. And so with acupuncture, this is something that I highly recommend. It works similarly to a massage. You want to go to a good person, but at the same point, you know, there's different areas, like you were talking about pressing in that one area and you can have relief. Here with acupuncture, we can go into certain areas that, you know, are not just the area, but other areas surrounding it that can give you good relief. Plus you're taking that downtime, it's very relaxing. And so if all your muscles are tensed up to protect your body from feeling pain, you can have them relax. So that's great.
You do acupuncture?
I don't we provide that at Marcus Integrative Health, which is part of FAU. So we offer that. You have to figure out what goes on with insurance. Sometimes it's covered, sometimes it's not covered, but we help you with that process.
That's at the Neuroscience Institute.
Yeah, I actually practice 2 different places. So I do my surgeries at the Neuroscience Institute, and then across the street, we have Integrative Health. Hyperbaric oxygen. This is a big thing, and it can work for a variety of people. Did it work for you?
Yes.
Okay.
Connect.
You're what?
My daughter has a facility.
Oh, okay. So, you know, hyperbaric is really like, people are looking at this in all different ways. You know how there's trends for things happening and, you know, people like, you know, like Dr. Scholl's. Did you guys see that? Dr. Scholl's are in again. So hyperbaric oxygen, when I first started training, it was something that was really popular, and then it fell out of favor, and now it's back in, and they're using it for all sorts of things. So they're using it for pain. There's also a number of studies going on it for PTSD and for some things about depression and anxiety. So,
excuse me,
yes, sir.
you had some pictures of, it looked like electrical stimulation.
Yes.
Did you talk about that? And I wasn't.
So the only thing I talked about there was for spinal cord stimulation. So spinal cord stimulation is really good for pain in the back and the legs, or the neck and the arms. And so that works really well. Peripheral nerve stimulation is a different option in a therapy that we do. And that can be useful if you have, sometimes for headache, that's off label. And then also sometimes for occipital neuralgia, if anybody suffers from that, for the nerves that go up the head. This into the brain are different operations I do either for pain or for movement disorders. And so that's if you know, obviously you're not going to have brain surgery if anything else works, but that is also an option. And we can do that in 2 different ways. Ironically, some of the deep structures in the brain can treat pain, but also, you know, you would think that you feel pain in the sensory area of the brain. It's actually not where we stimulate. We stimulate in the motor area of the brain, and that can relieve pain.
The thing you don't discuss is things like codeine, hydrocodone, or those.
Yeah.
They seem to be working universally. You don't have to find a specific spot.
Yeah.
So it does the whole body.
Right. So, you know, this is a question about should we use opioids and how are those used? So the whole story with opioids is, and you know, this has been a big epidemic, and it's especially popular or an issue here in Florida. And so what happened was we started with this pain scale. And with the pain scale, everybody started saying, okay, doctors started treating it like blood pressure. I have to make the number be perfect. I have to make the number be 3 or less. And then they were giving all sorts of drugs to make that number go down. And then what ended up happening is the prescribing of a lot of opioid medications that led to a lot of bad things happening. So, as it always does, the pendulum swings from one way to the other way. And so what ended up happening there was that then people said, oh, it's dangerous to prescribe opioids. But then there are people that have been living on their 2 hydrocodone a day. and doing pretty well, and their doctor says, no, I can't prescribe that anymore. So I think there's a role for this. Oftentimes with chronic pain, there are some side effects that go along with it, but in the right person, if you and your doctor say that is what works for you, you know, it can be very reasonable. So diet, how do you think diet plays into pain? Yep. Yeah, so she says it definitely plays into pain. Have you had any experience in different things that have worked? Mhm. And so one of the things that's kind of a hot topic right now is the anti-inflammatory diet for pain. So I think we generally talk about eating healthy and, you know, making sure that, you know, not necessarily any fad diets, but just Mediterranean diet. Oftentimes there's big advocates for plant-based diets, but anti-inflammatory diet, there's actually some studies now showing that it reduces pain. And so what are things that are inflammatory? Caffeine. That's something, anything that you would think of that you go, oh gosh, that would give me an upset stomach. Those are things that may be inflammatory. So, you know, any of the hot sauce or salsa, anything in terms of like hot peppers, anything acidic like grapefruit or oranges, those are things that can cause inflammation. So one simple way of, you know, trying to reduce and you can look online too to see what to take out of your diet just to reduce any chance of inflammation. Because basically pain causes your whole body to be under stress at all times.
You get things like constipation.
Yeah.
Which give you pain.
Yeah.
If you take a proper diet, say yoga, things like that.
Yeah.
No, I don't have any idea what that lady is saying.
Okay, so what was saying is constipation can be a source of pain. And so, you know, I think in terms of that, what you have to do is make sure that your bowels are working as they should. And when you have these healthy diets, and actually like some of the anti-inflammatory diets, that can make you very regular as well. So you have to find out what works for you, but there's definitely many options there.
So what is the anti-inflammatory diet?
You're going to try to do things that are mostly plant-based, some grain-based, things that aren't upsetting to your stomach. So think about do you ever get heartburn? Okay. So, you know, think about things like you're not going to have caffeine, you're not going to have tart berries, you're not going to have anything super spicy. Those are easy ways to take things out of your diet. Go ahead.
Oranges are an inflammatory food?
They can be if there's too much citrus in them because of the citrus acid.
Too much what?
If they're citrusy, and they can be acidic, and they can upset your stomach and upset.
How would you know if they're upsetting you? I eat an orange every day of my life.
I think you're fine. You know, if it doesn't bother you, you know, I
I
think,
don't think so.
right. But, you know, I think there's multiple ways. Yeah, I think there's multiple ways to take certain things out of your diet and then see, you know, try the other things. So, and see if it helps. How about sleep? Who sleeps well in here?
I sleep well.
Okay. Okay, we got a couple of people that sleep well. Who sleeps in the bed versus the recliner?
In the bed.
In the bed?
If I sleep.
Okay. Who sleeps in the recliner? Okay, you got a good crowd with sleeping in the bed, because yeah, and you know, so I think there's a lot of things, and I think this is really integral into helping to treat pain, because when you're tired, everything seems worse, right? And so, you know, how do you do this? You know, I think some of the things that you have to do are, we know as, you know, as we age that sleep doesn't come like it did before for a variety of reasons.
What do you think of melatonin?
I think it can be used really effectively in some people, and if it works for you, I think it's great. What it does is it changes your circadian rhythm, so it makes sure that you're sleeping at the right time and not sleeping at the other times. You have to also, you know, sometimes when you're not sleeping, then what happens? You want to nap all day. And then if you nap all day, then you can't sleep, right? So some of this is training yourself and your behavior and making sure that, you know, you're doing the best things. And then we all know the tricks about making sure that before you go to bed, you unplug from electronics or the TV and aren't watching that to get yourself all fired up before you go to bed. Sometimes, you know, that that whole thing about the hot milk or the hot tea before you go to bed can also be really helpful. Prioritize things larger than yourself. So what I mean by that is sometimes when we have pain and it becomes all encompassing, if we don't, we need another way to trick the brain, and we need to think about other things that we want to do that may make us think less about our pain. And so oftentimes, if somebody has an animal, something they have to do with their grandkid, a class you have to go to or you want to go to, this can be a way to get your mind, and I know it's miserable, but these are just some tricks that you can do to relieve your pain. Have a routine. This can be really helpful so that your body can help predict what you're going to do that day. And that can, if you're always running, what happens the next day? You feel awful. And so make sure that you're doing things like that. What do you do for relaxing?
Meditation.
Meditation? Yoga. And can you do that here?
Yes.
Awesome. So I think this can be really helpful. And I think that I always recommend meditation and yoga for all my patients, just as a time to get outside and, think about your body and think about your control of the pain that you're having.
Or if your body doesn't let you do yoga,
So
you can't get off the floor.
how about chair yoga?
They do it here, chair yoga.
Chair yoga. We don't want you getting on the
We do
floor.
chair yoga.
Okay.
How about pool yoga?
I love anything in the pool.
Anything in the pool.
Anything in the pool is what I highly recommend. Anything in the pool because it takes gravity out of the equation.
I can't go to the pool anymore. And I was a lap swimmer my whole life.
And then, anybody, Tai Chi is another thing that can be done where that's, very intentional movements. And again, that helps you with gaining control over your body.
That's good to do in the water, because unlike on the exercise, if you do in the gym,
Everything is
if
good
you
in the
fall,
water.
you gotta break something.
Yeah, no, I agree. The lady up front just said everything is good in the water. And I think the whole mantra is whatever you do, it's use it or lose it. So just keep moving.
That's the bottom line.
That is the bottom line. And then, I think it's really important that you come to things like this or come to things at, here. Because having this sense of community and being around one another is something that keeps us all going. And, I started this talk by mentioning the sense of community, and that's something that I've really found very special in this area in South Florida. And I think it's something that makes you all really lucky to live here and me to live here, and make sure that you take advantage of that because, getting through, it's a lot easier if you have support and friends around you to do that. So, go ahead.
Sorry to interrupt, but
Not at all.
you covered a lot of the treatments.
Yeah.
But a couple that I've heard
Yeah.
are supposed to help, but have not tried myself, is CBD
Mhm.
and cannabis. Would you talk about those, please, relative to pain?
Sure. I think in terms of CBD and cannabis are like very popular treatments right now. And, there's some dispensaries and a number of doctors that talk about it. And I think there's two different things. And, there's CBD and, then there's the active component of marijuana, the THC. And so CBD is the thing that's more prone to help pain. I've seen people do a variety of different things. If you're kind of interested, but you're not sure how far you want to go, a lot of people will talk about the benefits of CBD oil. And frankly, I see very little downside of trying it. Then if you think about going more into things that, that you're going to work with a doctor to do in terms of either, of any of the other things that you're ingesting, I think that's something to have a conversation about. I've seen it work very well for some people. There are different regulations in New York than there are here. But, I think trying the oil is a good place to start.
Now, what
So-
oil are you saying? You're saying it so fast.
He's asking about CBD.
Tea?
C as in cat,
Yeah.
B as, yeah. B as in boy, D as in dog.
Oil.
Oil.
Have you seen upsides for CBD then? I mean, in terms of research, has it been clinically
No.
established?
So, there's, I think that this was something where the research has not kept up with it. And so there's limited data. And, so I think while there's a lot of prescribers, everything about it has remained a bit anecdotal. One of the issues with the literature in pain is that most of the pain that's being provided isn't being, this is, my plug for academia, isn't being provided in academic offices and is often in busy practitioners' offices. So they're not collecting the data that's needed in order to justify use or come up with some of the things that have been done with different drugs where you say, okay, how many people need to be treated with this in order for it to be successful?
Is this by prescription?
So, it depends a little bit on the regulations in Florida. I have to be honest with you, I don't know. Dr. Joe, can you get CBD oil
Oh, yeah.
everywhere?
Oh,
everywhere. And do you have to,
You can get it in milkshake.
okay,
You can get it with dog food.
awesome.
But it's a pain down
You can
there.
get it anywhere.
Oh, yeah, a lot of doctors sell.
Okay,
And what do? Just rub it on you?
yeah. And, then there's certain things that, certain things that are rubbed in, and then there's certain things that you can ingest as well. Then there's other things that anybody use the Litoderm patches? Do those help anybody? Yeah. And so those patients used to kill me when I used to prescribe those because before they were off patent, it would be $250 for 10 of them. Now you can buy them at CVS for $12 for 10 of them. And so those are something great that are numbing patches that you can get
Try Arnica, it's amazing.
at the store. Arnica.
Arnica gel.
Okay. And, a kind of a similar thing where like a lot of the stuff we're talking about, either with massage or then, super invasive things like I do, you're tricking that area into feeling something different or not feeling. Go ahead.
So, could I just say something about the lidocaine?
Yeah. We have a user that would like to talk about it.
I prescribe them a lot. Thank you.
This is about the lidocaine patches. I prescribe them a lot and I use them quite a bit for my back. Just whenever I prescribe them though, you need to make sure that you get good ones. So the ones that you can get and just go to the store and buy that are good are Salonpas. That's good. It works. Salonpas. It's advertised on television and it sticks and it works. Some of the generic ones are very thin and don't work at all.
And can they get those at CVS?
Yes, you go. They're expensive. If you want to try them, sometimes Costco has them on sale, and you can get it cheap. The other thing is that they're 4% lidocaine. You can get 5% lidocaine by prescription, but again, you have to be careful about which ones you get because there's a difference. But they're very effective. If anybody suffers back aching like I do.
What about aromatherapy?
Oh, what about aromatherapy? So, I think that's a great thing. And, you again have to figure out what is going to work for you, and different things work for you. And I can see that, with it, you also participated and talked about the meditation and yoga. And so different aromas are better at different seasons. And so there's many things you can do with that in terms of different seasons and changes. And the diet can work seasonally too. Yeah. Any other questions? Any questions about FAU? Yeah.
Listening to all of this broad category, I have a friend who suffers from fibromyalgia.
Yeah.
And she's just constantly in pain. She doesn't live here, but she is in Delray.
Yeah, so I think that there's certain medication. So fibromyalgia can be a tough disease to treat, and it's important to find a doctor that listens to you. Is one part of it. The other part, there's certain of those neuropathic medications that we were talking about that work better for fibromyalgia than others. And then the other thing too is seeing how she's doing. Sometimes there's other things that can mimic fibromyalgia. So making sure you have the right diagnosis is an important thing. So you want to go to somebody that sees a lot of people with this that has expertise in that area. Either that could be a rheumatologist or it can be a pain neurologist. Tend to be some of the best people. Yeah.
Am I to assume that FAU has a department that specializes in pain management?
Yeah. So
Repeat the question, please.
So the question was, is she to assume that FAU has a department that specializes in pain management? So I am one of the doctors that does some of the surgical management for some of the things that we were talking about diet and massage and acupuncture and lifestyle. We also have a clinic that does that at Marcus Integrative Health. And then I work and do my operations at Marcus Neuroscience at Boca Regional. And there I have partners that do all the injections and other aspects of pain. So,
Well, how does one determine which doctor to go to begin with?
yeah. So I think sometimes you can talk to your primary care doc. If you want me to see you, I am happy to, and I can help direct you in the right way.
And how do we get to you?
I have business cards that I would love to give out.
I would like to know.
Okay.
Do you work with Dr. Ubeli?
I do.
That's my doctor.
Okay.
It's also Dr. Entity, that's the thing, doctor.
Yeah, there's a lot of different doctors in town that are quite good. And, I think that sometimes, just as you asked in terms of that question, what I think is the most important, and I think you hit it, was how do I know where to go? Because, sometimes if you end up with a person that does injections, what are they going to offer you? Injection. If you go to a surgeon, what are they going to offer you? Surgery. And so one of the ways I made my practice unique in New York was that I'll see you, and I'm not eager to do surgery on somebody that's not going to get better, but I'll point you in the direction that you need to go and provide that integrative guidance.
At what age do you stop recommending surgery?
At what age do you stop recommending surgery? It so depends on the person in terms of what you look like physiologically. How's your heart? How's the rest of your body? How's your mobility? Are you short of breath? And trying to figure out how you'll recover. So I think a lot of it depends on you, and we rely on you and your doctors to help us make the decision.
Okay, well, if anybody would like an easy recommendation, I think for certain things like bruises or like pain from overuse, you can't, if you have mild things like overuse, say of arms, or say throwing or walking a little too fast, or I find when I'm in the water doing things which are easy to do in the water, doing too much.
Yeah.
Arnicare, which is very reasonable and is over the counter, is the Arnica Montana in the gel or a cream. I prefer the gel. And you put it on, it's Arnicare gel or Arnicage. You can get it at Publix, you can get it at any store. And it's amazing because even if you have a bruise and you fall, you put that on immediately, you don't bruise. My daughter was accidentally once burned with hot water. And at the time we hadn't heard it, they had told us, put it on, and she did not blister. It's just amazing, and it's it's very inexpensive.
Right.
It's a cream, lotion, doesn't smell bad, it's good.
Well, thank you very much. I hope you learned something, and let me know how I can help with anything you need.
And where do I get your card?
I do. Let me grab it.
Do you feel better now?